ਪ੍ਰਸ਼ਾਸਨ ਦੇ ਚੀਫ ਮੈਡੀਕਲ ਅਧਿਕਾਰੀ ਡਾਕਟਰ ਲਾਰੈਂਸ ਲੋ ਨੇ ਕੋਵਿਡ-19 ਅੰਕੜਿਆਂ ਬਾਰੇ ਜਾਣਕਾਰੀ ਦਿੰਦੇ ਹੋਏ ਦੱਸਿਆ ਕਿ ਬ੍ਰੈਂਪਟਨ ਵਿੱਚ ਕੋਵਿਡ-19 ਦੇ 3987 ਮਾਮਲੇ ਸਾਹਮਣੇ ਆਏ ਨੇ ਅਤੇ 92 ਮੌਤਾਂ ਹੋਈਆਂ ਨੇ। ਨਾਲ ਹੀ ਡਾਕਟਰ ਲੋ ਨੇ ਕਿਹਾ ਹੈ ਕਿ ਅਸੀਂ ਕੋਵਿਡ-19 ਦਾ ਮੁਕਾਬਲਾ ਸੂਝ-ਬੂਝ ਨਾਲ ਕਰ ਰਹੇ ਹਾਂ।
As of this morning, Peel Public Health has investigated 3,987 cases of COVID-19 in Brampton. Of these, 3,780 have recovered, 115 cases are active, and 92 have passed away. Given our declining trends in severity and 7-day moving average of late, I am confident that we have largely exited the first wave of the pandemic in our community. But we cannot ease up. Community transmission continues, and this warrants caution and the steadfast practice of the core 4 behaviors: distancing, masking where that's not possible and where mandatory, hand washing, and also getting tested and staying home if you are sick. As Mayor Brown spoke to disparities in history in his opening remarks, I can share that last Friday, Peel Public Health released COVID-19 data based on race and occupation on our website at peelregion.ca/coronavirus. Our data shows that differences between groups in our community mirror trends that are seen elsewhere in Ontario, Canada, and the world. For the cases for which we have self-identified data, race data, visible minorities made up nearly 4 of 5 cases, despite making up only 2/3 of Peel's population. Residents who identify as South Asian, Black, and Latino are overrepresented compared to their proportion of Peel's population, while those who identify as white, East Asian or Southeast Asian, and Middle Eastern are underrepresented. For cases that we have occupational data for, healthcare workers were the most impacted by COVID-19, representing 1/3 of the cases which we analyzed, despite being only 5% of Peel's labor force. Transport and equipment operators represented the second group, making up nearly 1 in 5 of the cases we analyzed. And individuals employed in manufacturing and utilities ranked 3rd at 13% of the cases analyzed, notable because this group only represents 7% of Peel's labor force. Taken together, these numbers mean that those who have fallen sick from COVID-19 have already faced other structural disadvantage. These are the members of our community who kept us moving and who bore the brunt of infection through the highest part of the wave of the pandemic. Essential workers who could not work from home or who lived in close quarters. This means as we move forward together in practicing the core 4, we will continue to reduce transmission. But importantly, this is not about just taking care of ourselves, but the least fortunate in our community. And there's truly nothing more Canadian than looking out for your neighbor. That's why we are also working with school boards to review their reopening plans